Question 1. Cost-benefit analysis shows that a client requires a series of complex anatomical illustrations for a new medical textbook, emphasizing rapid production and a lower overall cost. The CMI must select digital illustration techniques that balance the need for scientific accuracy and detail with the client's budgetary and time constraints. Which approach best aligns with professional standards for a board-certified medical illustrator? Option A. Opting for vector-based illustration software and preset shapes to create simplified, stylized representations of anatomical elements, prioritizing a clean aesthetic over intricate detail and scientific nuance. Option B. Relying on automated illustration generation tools that can produce multiple variations quickly, with minimal manual input, and then selecting the closest option to the desired outcome with minor post-processing adjustments. Option C. Employing advanced digital painting techniques with custom brushes to meticulously render anatomical structures and pathological details, allowing for precise control over texture, lighting, and depth, while also facilitating efficient iterative revisions with the client. Option D. Utilizing readily available stock digital assets and generic brushes, focusing on quick assembly and minimal refinement to meet the deadline and cost targets, with a cursory review for general anatomical correctness. The correct answer is C. Employing advanced digital painting techniques with custom brushes to meticulously render anatomical structures and pathological details, allowing for precise control over texture, lighting, and depth, while also facilitating efficient iterative revisions with the client. Explanation. This scenario presents a professional challenge for a board-certified medical illustrator, CMI, due to the inherent tension between client demands for rapid turnaround and the ethical imperative to maintain scientific accuracy and artistic integrity in digital illustration. The CMI must balance efficiency with the responsibility to produce work that is not only aesthetically pleasing, but also medically sound and compliant with professional standards. Careful judgment is required to select digital illustration techniques that meet these competing demands without compromising quality or ethical obligations. The correct approach represents best professional practice because it prioritizes the integrity of the medical information being conveyed. Utilizing advanced digital illustration techniques that allow for precise anatomical rendering, accurate representation of pathological processes, and the ability to incorporate dynamic elements like cellular mechanisms or surgical procedures, ensures that the final illustration serves its educational and communicative purpose effectively. This aligns with the CMI's ethical duty to uphold scientific accuracy and to avoid misrepresentation, which is a cornerstone of professional medical illustration practice. Furthermore, employing techniques that facilitate iterative feedback and revision ensures client satisfaction while maintaining control over the accuracy of the final product. An incorrect approach that focuses solely on speed and cost reduction by employing overly simplistic or generalized digital brushes and techniques would fail to meet the required level of anatomical precision and scientific detail. This could lead to misinterpretations by the target audience, violating the CMI's ethical obligation to produce accurate representations. Another incorrect approach that involves using pre-made, generic digital assets without significant modification or verification of their medical accuracy would similarly compromise scientific integrity. This bypasses the critical step of ensuring that the visual elements precisely reflect the intended medical context, potentially leading to factual errors. A third incorrect approach that neglects to consider the intended medium and audience for the illustration, opting for techniques that are unsuitable for print or digital display, would result in a product that is functionally deficient, even if scientifically accurate. This demonstrates a failure to fully understand and execute the communicative goals of the project. Professionals should employ a decision-making framework that begins with a thorough understanding of the project's objectives, target audience, and scientific content. This is followed by an assessment of available digital illustration techniques, evaluating each for its ability to achieve anatomical accuracy, scientific fidelity, and aesthetic quality within the project's constraints. A critical step is to consider the iterative nature of medical illustration, ensuring that chosen techniques allow for client review and necessary revisions without compromising the core scientific message. Ethical considerations, particularly regarding accuracy and avoiding misrepresentation, must be paramount throughout the decision-making process. Question 2. The efficiency study reveals that the medical illustration department is under pressure to produce a high volume of anatomical illustrations for a new textbook. To meet deadlines, the department head is considering implementing a new workflow that emphasizes speed. When tasked with illustrating the musculature of the human forearm, an illustrator is presented with two potential workflows. One that involves quickly sketching from memory and cross-referencing only if a significant doubt arises, and another that mandates a thorough review of current anatomical atlases and peer-reviewed literature for precise origin, insertion, and innervation details before commencing any illustration. Which workflow best upholds the professional responsibilities of a board-certified medical illustrator in the United States? Option A, mandating a thorough review of current anatomical atlases and peer-reviewed literature for precise origin, insertion, and innervation details before commencing any illustration. Option B, delegating the anatomical verification to a junior assistant who has a general understanding of human anatomy, allowing the lead illustrator to focus on the artistic rendering. Option C, prioritizing speed by using previously created illustrations of similar anatomical regions, assuming they are sufficiently accurate for the new textbook. Option D, relying on the illustrator's existing knowledge and only consulting external resources if a significant anatomical discrepancy is immediately apparent during the sketching process. Correct answer is A, mandating a thorough review of current anatomical atlases and peer-reviewed literature for precise origin, insertion, and innervation details before commencing any illustration. Explanation: the efficiency study reveals a need to streamline the creation of anatomical illustrations for a new medical textbook. The challenge lies in ensuring that despite the pressure for speed, the anatomical accuracy and adherence to established medical terminology remain paramount. Medical illustrators operate under a professional code of ethics and, in the U.S. context, are guided by principles that prioritize accuracy and clarity in communicating complex medical information. Misrepresenting anatomical structures can lead to significant misunderstandings for medical students and practitioners, potentially impacting patient care. Therefore, the decision-making process must balance efficiency with an unwavering commitment to scientific integrity. The correct approach prioritizes verification of anatomical structures against authoritative sources before proceeding with illustration. This aligns with the ethical obligation of medical illustrators to produce accurate and scientifically sound work. By consulting peer-reviewed literature, anatomical atlases, and potentially subject matter experts, the illustrator ensures that the visual representation is a faithful depiction of human anatomy. This meticulous verification process is the cornerstone of professional practice, safeguarding against the dissemination of misinformation and upholding the credibility of the medical illustration field. An incorrect approach that involves relying solely on memory or previous, potentially outdated, illustrations is professionally unacceptable. This bypasses the critical step of verification, increasing the risk of perpetuating errors or inaccuracies. Such a failure directly contravenes the ethical imperative for accuracy and could be seen as a breach of professional responsibility, as it prioritizes speed over correctness. Another incorrect approach that is professionally unsound is to assume that a general understanding of anatomy is sufficient for specialized textbook illustration. While a broad knowledge base is essential, the detailed and precise representation required for educational materials necessitates a deeper dive into specific anatomical relationships, variations, and terminology. Failing to consult detailed resources for specific illustrations demonstrates a lack of diligence and a disregard for the precision demanded by the field. The professional decision-making framework for this scenario involves a systematic process. 1. Understand the objective: to create accurate anatomical illustrations efficiently. 2. Identify potential risks: anatomical inaccuracies due to time constraints. 3. Prioritize core professional values: accuracy, clarity, and ethical responsibility. 4. Implement a verification protocol: always cross-reference anatomical details with current authoritative sources. 5. Evaluate efficiency gains against accuracy compromises: never sacrifice accuracy for speed. 6. Seek expert consultation when necessary. If in doubt about any anatomical detail, consult with anatomists or relevant medical specialists. Question 3. Benchmark analysis indicates that a medical illustrator has been commissioned to create visuals of the human skeletal system for a general public health awareness campaign. The client has requested very simple drawings to ensure broad understanding, but the illustrator is concerned that oversimplification might misrepresent crucial anatomical relationships and the potential for skeletal pathologies. Considering the CMI's ethical obligations and the need for effective communication, which approach best balances accuracy with accessibility? Option A. Create a single, highly abstract diagram that focuses only on the overall silhouette of the skeleton, omitting all specific bone names and joint types. Option B. Generate a simplified diagram that highlights only the most superficial bones, ignoring all underlying structures and internal articulations. Option C. Develop a series of illustrations that begin with a basic overview of major bones and joints, then progressively introduce more detailed anatomical features and common conditions as the series progresses. Option D. Produce a set of highly detailed, technically accurate anatomical illustrations of the entire skeletal system, with no modifications for simplification. The correct answer is C. Develop a series of illustrations that begin with a basic overview of major bones and joints, then progressively introduce more detailed anatomical features and common conditions as the series progresses. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical illustrator to balance the need for accurate anatomical representation of the skeletal system with the potential for misinterpretation by a non-medical audience. The client's request for simplification, while aiming for clarity, risks oversimplification that could lead to a misunderstanding of critical anatomical relationships or pathological conditions. The CMI's responsibility is to uphold scientific accuracy while ensuring effective communication, a delicate balance that demands careful judgment. Correct approach analysis. The correct approach involves creating a series of illustrations that progressively reveal complexity. This method adheres to best professional practice by prioritizing accuracy and educational value. It allows for a foundational understanding of the basic skeletal structure before introducing more detailed or nuanced information. This aligns with ethical guidelines for medical illustration, which mandate truthful and accurate representations. By offering layered visuals, the illustrator ensures that the information is accessible without sacrificing scientific integrity, thereby fulfilling the CMI's duty to provide reliable visual information. Incorrect approaches analysis. One incorrect approach is to immediately create a highly simplified diagram that omits key anatomical landmarks. This fails to meet the standard of accuracy expected of a CMI and could mislead the audience about the true structure of the skeletal system. It violates the ethical obligation to present scientifically sound information. Another incorrect approach is to refuse the client's request for simplification entirely and present only highly detailed, complex anatomical renderings. While scientifically accurate, this approach fails to meet the client's communication objective of making the information accessible to a non-medical audience. It demonstrates a lack of understanding of effective visual communication principles and a failure to collaborate effectively with the client. A third incorrect approach is to create a single, overly generalized illustration that attempts to capture all aspects of the skeletal system at a superficial level. This risks being both inaccurate in its details and ineffective in conveying meaningful information, failing to serve either the scientific or communication goals of the project. Professional reasoning. Professionals should approach such requests by first understanding the target audience and the specific communication goals. They should then engage in a dialogue with the client to explore how simplification can be achieved without compromising accuracy. This often involves proposing a phased approach to illustration, starting with basic structures and gradually adding detail as needed. The CMI must always be prepared to justify their artistic and scientific decisions based on established principles of medical illustration and ethical standards. Question 4. Process analysis reveals that a board-certified medical illustrator, CMI, is tasked with creating an illustration of the human endocrine system for a general audience educational pamphlet. The illustrator must decide how to represent the complex feedback mechanisms involved in thyroid hormone regulation, which approach best upholds the professional standards and ethical obligations of a CMI. Option A. Focus solely on the thyroid gland's production of hormones, omitting the regulatory signals from the brain to simplify the visual for a general audience. Option B. Depict the feedback loop accurately, showing the interplay between the hypothalamus, pituitary gland, and thyroid gland, including the inhibitory effects of thyroid hormones on the hypothalamus and pituitary. Option C. Use a diagram that depicts the thyroid gland as a standalone organ, disconnected from any regulatory pathways, to avoid confusing the audience with complex hormonal interactions. Option D. Illustrate the thyroid gland with exaggerated size and prominence, suggesting it is the primary driver of all bodily functions, to make the illustration more visually impactful. The correct answer is B. Depict the feedback loop accurately, showing the interplay between the hypothalamus, pituitary gland, and thyroid gland, including the inhibitory effects of thyroid hormones on the hypothalamus and pituitary. Explanation. This scenario presents a professional challenge for a board-certified medical illustrator, CMI, due to the inherent complexity of accurately depicting the intricate systems of the human body while adhering to strict regulatory and ethical standards. The need for precision in anatomical representation directly impacts patient understanding, educational efficacy, and potentially clinical decision-making, making the illustrator's judgment paramount. The correct approach represents best professional practice because it prioritizes accuracy, clarity, and adherence to established anatomical and physiological principles, which are implicitly governed by the CMI certification's commitment to professional standards. This ensures that the visual information conveyed is scientifically sound and ethically responsible, aligning with the core tenets of medical illustration as a profession dedicated to accurate visual communication in healthcare and education. The CMI certification itself implies a commitment to upholding these standards, which are foundational to the practice. An incorrect approach that misrepresents the vascular supply to a specific organ system, such as the kidneys, fails to meet the fundamental requirement of anatomical accuracy. This failure constitutes a breach of professional ethics by providing misleading information, which could have serious consequences if relied upon for educational or clinical purposes. It directly contravenes the implicit mandate of the CMI certification to produce work that is scientifically valid. Another incorrect approach that oversimplifies a complex physiological process, like the hormonal regulation of the adrenal glands, to the point of omitting critical feedback loops, also represents a regulatory and ethical failure. While simplification can be necessary for certain audiences, rendering a process fundamentally inaccurate undermines the educational value and can lead to misconceptions. This is unacceptable for a certified professional who is expected to convey complex information with integrity. A third incorrect approach that uses outdated anatomical terminology or depictions, failing to incorporate current scientific consensus on the structure of the nervous system, is also professionally unacceptable. Medical knowledge evolves, and a CMI is expected to remain current. Relying on outdated information is a failure to maintain professional competence and can lead to the dissemination of incorrect knowledge, a clear ethical lapse. The professional reasoning process for similar situations should involve a thorough understanding of the target audience and the intended use of the illustration. It requires rigorous research using current, reputable scientific literature and consultation with subject matter experts when necessary. The CMI must then apply their artistic and scientific expertise to translate this information into a clear, accurate, and ethically sound visual representation, always prioritizing the integrity of the scientific content. Question 5. The assessment process reveals that a medical illustrator is tasked with creating a series of detailed illustrations for a medical school curriculum, depicting a rare congenital condition. The illustrator has access to de-identified patient case files, including clinical photographs and descriptive notes, but no direct patient contact. The illustrator is considering how to best proceed to ensure both educational accuracy and strict adherence to patient privacy regulations. Which approach best balances these requirements? Option A. Proceed with creating the illustrations based on the de-identified case files, assuming that the de-identification process is sufficient to protect patient privacy without further verification or consent. Option B. Create the illustrations using the de-identified case files, and then seek retrospective consent from the patients after the illustrations are completed and integrated into the curriculum. Option C. Obtain explicit, informed consent from the patients whose de-identified case files are being used, and meticulously review and confirm with the healthcare provider that all protected health information, PHI, has been effectively removed from the source materials before commencing illustration. Option D. Utilize generic anatomical models and publicly available medical imagery to represent the condition, even if it means sacrificing some of the specific details observed in the patient case files. The correct answer is C. Obtain explicit, informed consent from the patients whose de-identified case files are being used, and meticulously review and confirm with the healthcare provider that all protected health information, PHI, has been effectively removed from the source materials before commencing illustration. Explanation. Scenario analysis. This scenario presents a common challenge for medical illustrators operating within the healthcare and education sectors. The core difficulty lies in balancing the need for accurate, effective visual communication with the ethical and legal obligations surrounding patient privacy and data integrity. Medical illustrators often work with sensitive patient information to create educational materials, and ensuring that these materials do not inadvertently reveal identifiable patient data is paramount. This requires a nuanced understanding of privacy regulations and a proactive approach to data anonymization and consent. Correct approach analysis. The correct approach prioritizes patient privacy and adheres strictly to the Health Insurance Portability and Accountability Act (HIPAA) regulations. By obtaining explicit, informed consent from patients for the use of their likeness in educational materials, and by implementing robust anonymization techniques to remove any protected health information. PHI. Before illustration, the medical illustrator upholds the highest ethical and legal standards. This approach ensures that the educational value of the illustration is achieved without compromising patient confidentiality, which is a cornerstone of trust in healthcare. Incorrect approaches analysis. One incorrect approach involves proceeding with illustration without obtaining explicit patient consent, even if the illustrator believes the information is sufficiently anonymized. This directly violates HIPAA privacy rule, which mandates patient authorization for the use and disclosure of PHI for purposes beyond treatment, payment, and healthcare operations. Even if the intent is educational, the use of identifiable patient data without consent is a serious breach. Another incorrect approach is to rely solely on the assumption that anonymization is sufficient without verifying it with the healthcare provider or institution. This overlooks the responsibility of the illustrator to actively ensure that all PHI has been removed. The definition of PHI is broad and can include subtle identifiers. Failure to confirm the completeness of anonymization with the data source can lead to unintentional PHI disclosure, a violation of HIPAA. A third incorrect approach is to use publicly available images or generic anatomical references instead of patient-specific data when the intent is to illustrate a specific condition or procedure observed in a patient. While this avoids privacy concerns, it compromises the educational accuracy and relevance of the illustration if the goal was to depict a particular patient's case for teaching purposes. This fails to meet the core requirement of providing accurate, contextually relevant medical illustrations for healthcare and education, thereby undermining the illustrator's role. Professional reasoning. Medical illustrators must adopt a risk-averse and compliance-focused mindset when handling patient data. The decision-making process should always begin with a thorough understanding of applicable privacy laws, such as HIPAA in the U.S. When patient data is involved, the primary steps are to 1. Ascertain the need for patient consent, 2. Implement rigorous anonymization protocols, and 3. Verify the effectiveness of anonymization with the originating entity. If the educational objective can be met without using patient-specific data, that is often the safest and most ethical route. However, when patient-specific illustration is necessary, a multi-layered approach to privacy protection is essential. Question 6. Operational review demonstrates that a medical illustration practice is considering expanding its service offerings. Which of the following proposed services most accurately reflects the defined scope and core purpose of board-certified medical illustration? Option A. Providing general administrative support and document formatting for a medical research institution. Option B. Developing detailed anatomical and procedural illustrations for a surgical training simulation platform. Option C. Designing social media graphics for a wellness influencer that focus on general healthy lifestyle tips without specific medical detail. Option D. Creating abstract artistic murals for the exterior of a new hospital wing. The correct answer is B. Developing detailed anatomical and procedural illustrations for a surgical training simulation platform. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires distinguishing between the core definition and scope of medical illustration as a regulated profession versus broader visual communication or artistic endeavors. Misinterpreting this distinction can lead to practicing outside the defined scope, potentially violating professional standards and regulatory expectations for board-certified medical illustrators, CMI. The challenge lies in applying the CMI's established professional boundaries to a novel or evolving service offering. Correct approach analysis. The correct approach aligns with the established definition and scope of medical illustration as recognized by the CMI certification. This involves ensuring that any service offered directly supports the understanding, diagnosis, treatment, or education related to human anatomy, physiology, pathology, or medical procedures. This adherence is crucial for maintaining professional integrity, upholding the standards set by the certifying body, and ensuring that the services provided are within the recognized expertise and ethical framework of a CMI. It directly addresses the core purpose of medical illustration, to communicate complex medical information accurately and effectively to specific audiences. Incorrect approach is analysis, an approach that includes creating purely aesthetic artwork for a medical facility's waiting room, without any direct educational or informational medical content, falls outside the scope of medical illustration. This is an artistic service, not a medical illustration service, and therefore does not align with the CMI's professional definition. It represents a failure to adhere to the core purpose of the profession, an approach that involves developing marketing materials for a pharmaceutical company that focus solely on brand promotion and general lifestyle imagery, without illustrating specific medical concepts, mechanisms of action, or anatomical details, also deviates from the scope. Related to the healthcare industry, it prioritizes marketing over accurate medical communication, which is the hallmark of medical illustration. This is a failure to apply the professional's expertise to its intended purpose, an approach that involves providing general graphic design services for a hospital's administrative departments, such as creating internal memo templates or departmental signage unrelated to patient care or medical information, is also outside the defined scope. This is a general design service and does not leverage the specialized knowledge and skills of a medical illustrator in communicating medical concepts. It represents a misapplication of professional credentials. Professional reasoning. Professionals should approach service offerings by first referencing the official definition and scope of practice for a board-certified medical illustrator. This involves asking, does this service directly contribute to the accurate visual communication of medical information for educational, diagnostic, or therapeutic purposes? If the answer is clearly yes, and the service utilizes the unique skills of a medical illustrator, it is likely within scope. If the service leans more towards general art marketing or administrative design, it is likely outside the defined scope and should be declined or referred to a different professional. This systematic evaluation ensures adherence to professional standards and regulatory expectations. Question 7. Process analysis reveals that the historical development of medical illustration involved significant contributions from artists working without the formal structures of modern professional certification. Considering the evolution of ethical standards and intellectual property recognition within the field, which of the following approaches best reflects the understanding required for a board-certified medical illustrator (CMI) when evaluating the legacy of early medical illustrators? Option A. Prioritize the artistic innovation of historical medical illustrations, viewing them as a benchmark of quality that modern illustrators should strive to emulate, regardless of evolving ethical considerations. Option B. Emphasize the purely aesthetic aspects of historical medical illustrations, suggesting that their artistic merit supersedes any need to consider the evolution of scientific accuracy or intellectual property rights. Option C. Acknowledge the foundational artistic contributions of early illustrators, while recognizing that their work predates modern ethical frameworks for attribution and intellectual property, necessitating a contemporary ethical lens for their evaluation. Option D. Conclude that the lack of formal certification and copyright awareness among early medical illustrators renders their work less relevant to contemporary professional standards and ethical obligations. The correct answer is C. Acknowledge the foundational artistic contributions of early illustrators, while recognizing that their work predates modern ethical frameworks for attribution and intellectual property, necessitating a contemporary ethical lens for their evaluation. Explanation. This scenario presents a professional challenge because it requires a medical illustrator to navigate the historical evolution of their field while adhering to the specific ethical and professional standards expected of a board-certified medical illustrator, CMI. The core of the challenge lies in understanding how past practices, while foundational, may not align with current CMI certification requirements and ethical guidelines regarding attribution, intellectual property, and the responsible representation of scientific information. Careful judgment is required to distinguish between historical context and contemporary professional obligations. The correct approach represents best professional practice because it demonstrates a nuanced understanding of the historical development of medical illustration and its impact on current professional standards. It acknowledges the contributions of early practitioners without suggesting that their methods or ethical considerations are directly transferable to modern CMI practice. This approach emphasizes the importance of recognizing the evolution of copyright, attribution, and the ethical imperative to accurately represent scientific data, all of which are implicitly or explicitly governed by the principles underlying CMI certification. By focusing on the evolution of these concepts, it highlights the continuous professional development and ethical awareness expected of a CMI. An incorrect approach that focuses solely on the artistic merit of historical works, without considering their context or the evolution of intellectual property laws, fails to meet CMI standards. This is an ethical failure because it overlooks the importance of proper attribution and the potential for misrepresenting the origin of artistic concepts in a field where accuracy and provenance are paramount. Another incorrect approach that suggests historical illustrations are inherently superior or more authentic than contemporary ones is also ethically problematic. This devalues the advancements in technology, scientific understanding, and ethical considerations that have shaped modern medical illustration, potentially leading to the adoption of outdated or less rigorous practices. Furthermore, an approach that dismisses the need for understanding historical context as irrelevant to current practice is a failure of professional due diligence, as it neglects the foundational knowledge that informs contemporary ethical and technical standards. The professional decision-making process for similar situations should involve a critical assessment of the historical context, identifying how it informs but does not dictate current best practices. Professionals should always consider the ethical implications of their work, including intellectual property, attribution, and the accurate representation of information, in light of current regulatory and professional guidelines. Understanding the evolution of the field allows for a more informed and ethically sound application of contemporary standards. Question 8. The risk matrix shows a moderate likelihood of public misunderstanding regarding the cellular mechanisms of gamete formation and fertilization when presented without clear visual context. As a board-certified medical illustrator tasked with creating visuals for a public health campaign on reproductive health, which approach best navigates this risk while adhering to professional standards? Option A. Depict a dramatic and emotionally charged scene of conception, emphasizing the miracle aspect with symbolic imagery to evoke a strong emotional response from the audience. Option B. Focus on the external anatomical structures of the reproductive organs, using simplified diagrams that highlight their general form and function without delving into the microscopic cellular processes. Option C. Illustrate the key cellular stages of meiosis and fertilization, focusing on accurate representation of chromosomal behavior and the fusion of gametes, while employing clear labeling and concise explanatory text to demystify the process. Option D. Create highly stylized and abstract representations of gametes and fertilization to avoid any potentially controversial or explicit imagery, prioritizing broad appeal over precise scientific detail. Correct answer is C. Illustrate the key cellular stages of meiosis and fertilization, focusing on accurate representation of chromosomal behavior and the fusion of gametes, while employing clear labeling and concise explanatory text to demystify the process. Explanation. This scenario presents a professional challenge due to the inherent sensitivity and potential for misinterpretation when illustrating complex reproductive anatomy and processes for a diverse audience. The challenge lies in balancing scientific accuracy with ethical considerations, ensuring the visuals are informative without being gratuitous or misleading, and adhering to the specific professional standards expected of a board-certified medical illustrator, CMI. Careful judgment is required to select the most appropriate visual representation that aligns with the intended educational or informational purpose. The correct approach represents best professional practice because it prioritizes clarity, accuracy, and ethical representation within the established CMI framework. By focusing on the anatomical structures and physiological processes relevant to the specific context, e.g., fertility treatments, disease education, the illustrator ensures the visuals serve a clear educational or informational purpose. This aligns with the CMI's commitment to producing scientifically sound and ethically responsible medical illustrations. The emphasis on avoiding sensationalism or overly graphic detail when not medically necessary upholds professional integrity and respects the audience. An incorrect approach that focuses solely on the most visually dramatic or potentially shocking aspects of reproductive processes without clear educational justification, fails to meet CMI standards. This could be considered ethically problematic, as it may exploit sensitive topics for shock value rather than for genuine understanding, potentially causing distress or misrepresenting the scientific reality. Another incorrect approach that omits crucial anatomical details or simplifies complex physiological interactions to the point of inaccuracy undermines the core responsibility of a medical illustrator to provide scientifically accurate information. This failure to represent the reproductive system faithfully can lead to misunderstanding and misinformation, which is a direct contravention of professional ethical obligations. The professional decision-making process for similar situations should involve a thorough understanding of the project's objectives, the target audience, and the specific ethical guidelines governing medical illustration. A critical evaluation of potential visual representations should be conducted, weighing scientific accuracy against the potential for misinterpretation or ethical compromise. Consultation with subject matter experts and adherence to established CMI professional conduct principles are essential steps in ensuring the final illustration is both effective and ethically sound. Question 9. Comparative studies suggest that the accuracy of anatomical and physiological illustrations significantly impacts the understanding of complex biological processes. When tasked with creating an illustration depicting the intricate cascade of intracellular signaling pathways involved in a specific disease state, which approach best mitigates the risk of misrepresenting the underlying science and potentially leading to flawed interpretations by medical professionals or students? Option A. Relying on a generalized, aesthetically pleasing stock illustration that broadly represents cellular communication, assuming the core concepts are universally applicable. Option B. Conducting thorough research using peer-reviewed literature and consulting with subject matter experts to ensure precise depiction of molecular components, their interactions, and the spatial and temporal dynamics of the signaling cascade. Option C. Basing the illustration on personal interpretation of readily available online diagrams, assuming a common understanding of cellular biology among the intended audience. Option D. Prioritizing a visually dynamic and simplified representation that emphasizes the overall flow of information, even if it means omitting or abstracting certain molecular interactions. The correct answer is A. Relying on a generalized, aesthetically pleasing stock illustration that broadly represents cellular communication, assuming the core concepts are universally applicable. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical illustrator to balance the need for accurate anatomical representation with the potential for misinterpretation or oversimplification that could lead to patient harm. The inherent complexity of human physiology, especially in dynamic processes like cellular signaling, demands a high degree of precision. Misrepresenting these mechanisms, even subtly, could lead to flawed understanding by the intended audience, impacting clinical decision-making or patient education. The pressure to deliver a visually appealing and easily digestible illustration must not compromise scientific integrity. Correct approach analysis. The correct approach involves a rigorous, multi-stage review process that prioritizes scientific accuracy and clarity. This includes consultation with subject matter experts, physicians, researchers, to validate the anatomical and physiological details, cross-referencing with peer-reviewed literature and established anatomical atlases, and potentially seeking feedback from the target audience to ensure comprehension without sacrificing accuracy. This methodical approach aligns with the ethical obligations of a board-certified medical illustrator to produce work that is both artistically sound and scientifically defensible, minimizing the risk of disseminating misinformation. Adherence to established scientific consensus and best practices in anatomical representation is paramount. Incorrect approaches analysis. One incorrect approach is to rely solely on existing, potentially outdated or generalized stock imagery without independent verification. This fails to account for the specific nuances of the requested illustration and risks perpetuating inaccuracies. Ethically, this demonstrates a lack of due diligence and a failure to uphold the standard of care expected of a certified professional. Another incorrect approach is to prioritize aesthetic appeal over scientific accuracy, opting for simplified or stylized representations that might be visually pleasing but misrepresent critical physiological processes. This violates the core principle of medical illustration, which is to communicate complex biological information accurately. Regulatory frameworks for medical professionals, including illustrators who contribute to medical knowledge dissemination, implicitly require accuracy to prevent harm. A third incorrect approach is to proceed with illustration based on personal interpretation without seeking expert validation. While artistic interpretation is part of the process, it must be grounded in scientific fact. Without expert review, the illustrator risks introducing subjective biases or misunderstandings of complex physiological pathways, leading to illustrations that are factually incorrect and potentially misleading. This constitutes a failure to meet the professional standard of care and an ethical breach of responsibility to the audience. Professional reasoning. Professionals should adopt a systematic approach to anatomical and physiological illustration. This begins with a thorough understanding of the brief and the target audience. Next, extensive research using authoritative sources is essential. Consultation with subject matter experts is not optional but a critical step in validating accuracy. An iterative review process, incorporating feedback from both experts and the intended audience, helps refine the illustration for both clarity and precision. Finally, maintaining meticulous records of sources and consultations provides a defensible trail of the decision-making process. This framework ensures that the final product is scientifically accurate, ethically sound, and effectively communicates complex information. Question 10. The risk matrix shows a high probability of patient anxiety when visualizing the inflammatory cascade of a chronic autoimmune disease. Which approach best balances the need for accurate pathophysiological representation with patient well-being and ethical communication standards for a board-certified medical illustrator? Option A. Focus on a simplified, abstract representation of the inflammatory cascade that avoids specific cellular details, prioritizing a general sense of cellular disruption to minimize potential patient distress. Option B. Utilize a highly detailed and graphic depiction of tissue damage caused by the inflammation, as this most accurately reflects the potential long-term consequences of the disease. Option C. Create a visually dramatic and emotionally charged illustration that emphasizes the destructive aspects of the inflammation to convey the severity of the disease, assuming this will better engage the audience. Option D. Depict the inflammatory cascade using clear, scientifically accurate diagrams that illustrate the cellular and molecular mechanisms involved, while employing a neutral color palette and avoiding overly graphic or alarming imagery. Include concise explanatory text that contextualizes the process without sensationalizing it. The correct answer is D. Depict the inflammatory cascade using clear, scientifically accurate diagrams that illustrate the cellular and molecular mechanisms involved, while employing a neutral color palette and avoiding overly graphic or alarming imagery. Include concise explanatory text that contextualizes the process without sensationalizing it. Explanation. This scenario presents a professional challenge because it requires the medical illustrator to accurately and ethically represent complex pathophysiological processes for a specific audience, adhering to the standards set by the board-certified medical illustrator (CMI) certification. The core of the challenge lies in translating scientific understanding into a visual format that is both informative and avoids misinterpretation, particularly when dealing with sensitive or potentially alarming conditions. Careful judgment is required to ensure the visual representation aligns with current scientific consensus and regulatory expectations for medical communication. The correct approach represents best professional practice because it prioritizes accuracy, clarity, and adherence to established scientific and ethical guidelines for medical illustration. By consulting with subject matter experts and referencing peer-reviewed literature, the illustrator ensures the visual depiction of pathophysiology is scientifically sound and up-to-date. This aligns with the CMI's commitment to maintaining high standards of professional competence and ethical conduct in medical visualization. The focus on clear, unambiguous representation directly serves the educational and informational goals of the intended audience, fulfilling the illustrator's professional responsibility. An incorrect approach that focuses solely on aesthetic appeal without scientific rigor fails to meet the fundamental purpose of medical illustration, which is to accurately convey complex medical information. This can lead to misinformed understanding by the audience and potentially violate ethical obligations to present information truthfully. Another incorrect approach that oversimplifies or sensationalizes the pathophysiology risks misrepresenting the condition, potentially causing undue alarm or downplaying its severity. This undermines the credibility of the medical illustrator and the information being conveyed, and could be seen as a breach of professional integrity. A third incorrect approach that relies on outdated or unverified information directly contradicts the CMI's requirement for current knowledge and accurate representation, leading to the dissemination of potentially harmful misinformation. The professional decision-making process for similar situations should involve a systematic evaluation of the project's objectives, the target audience's knowledge level, and the scientific accuracy required. It necessitates a commitment to ongoing learning and consultation with subject matter experts. When faced with complex pathophysiological concepts, the professional should always prioritize evidence-based information and ethical considerations, ensuring that the visual output is both scientifically valid and professionally responsible, thereby upholding the standards of the CMI certification. Question 11. To address the challenge of creating a compelling medical illustration that accurately depicts a complex surgical procedure while minimizing the risk of misinterpretation by a lay audience, which design approach best balances aesthetic impact with scientific integrity and ethical communication? Option A. Employing a minimalist design with clear anatomical labeling and a limited, high-contrast color palette to emphasize key structures and actions. Option B. Focusing on a dramatic, cinematic lighting scheme and exaggerated perspective to create a sense of urgency and highlight the surgeon's skill. Option C. Incorporating a dense, detailed illustration with numerous overlapping elements and a wide spectrum of subtle color variations to showcase the intricacy of the surgical field. Option D. Utilizing a highly stylized, abstract representation with vibrant, non-realistic colors and dynamic visual effects to convey the intensity of the procedure. The correct answer is A. Employing a minimalist design with clear anatomical labeling and a limited high-contrast color palette to emphasize key structures and actions. Explanation. Scenario analysis. This scenario presents a professional challenge for a board-certified medical illustrator, CMI, due to the inherent tension between achieving aesthetic impact and ensuring scientific accuracy and clarity in visual communication. The risk assessment involves evaluating how design choices might inadvertently mislead the audience or obscure critical information, thereby compromising the educational or informational purpose of the illustration. A CMI must balance artistic expression with the ethical obligation to present medical information truthfully and effectively, adhering to the principles of good design that prioritize comprehension and avoid misinterpretation. Correct approach analysis. The correct approach prioritizes clarity, accuracy, and the effective communication of complex medical information. This involves employing design principles such as hierarchy, contrast, and balance to guide the viewer's eye to the most important elements, ensuring that anatomical structures and pathological processes are depicted with fidelity. Color theory is applied judiciously to differentiate tissues or highlight abnormalities without creating artificial visual cues. The use of negative space is optimized to prevent visual clutter and enhance focus. This approach aligns with the CMI's ethical responsibility to produce illustrations that are not only visually appealing, but also scientifically sound and educationally valuable, thereby minimizing the risk of misinterpretation and upholding professional standards. Incorrect approaches analysis. An approach that overemphasizes dramatic visual effects at the expense of anatomical precision or clarity introduces significant risk. For instance, using overly saturated colors or exaggerated lighting to create a wow factor could distort the perception of tissue characteristics or spatial relationships, leading to a misrepresentation of the medical condition. Similarly, employing complex, abstract design elements that detract from the core medical message or obscure key anatomical landmarks would fail to meet the primary objective of medical illustration. Such choices could be considered ethically problematic as they prioritize aesthetic novelty over accurate information dissemination, potentially leading to misunderstanding by the intended audience, which is contrary to the core tenets of professional medical illustration practice. Professional reasoning. Professionals should approach design challenges by first identifying the primary communication objective of the illustration. This involves understanding the target audience and the specific information that needs to be conveyed. A risk assessment should then be conducted, considering how various design choices might impact comprehension, accuracy, and potential for misinterpretation. The decision-making process should involve iterative refinement, seeking feedback from subject matter experts and peers to ensure that the design effectively balances aesthetic appeal with scientific integrity. Adherence to established principles of visual design, coupled with a commitment to ethical practice, forms the foundation for sound professional judgment. Question 12. Strategic planning requires a medical illustrator to consider the ethical implications of client requests. A pharmaceutical company approaches a board-certified medical illustrator, CMI, to create an illustration for a new drug advertisement. The client specifically requests that the illustration visually minimize the potential side effects of the drug, stating that the advertisement needs to focus solely on the benefits to ensure market success. The CMI is aware that accurately depicting the potential side effects, even if less prominent than the benefits, is crucial for informed consent and responsible patient communication. What is the most ethically sound approach for the CMI to take in this situation? Option A. Immediately refuse the project without further discussion, citing ethical concerns about the client's request to downplay side effects. Option B. Create an illustration that solely focuses on the benefits of the drug as requested by the client, omitting any visual representation of potential side effects to ensure the advertisement's market success. Option C. Create an illustration that accurately depicts both the benefits and potential side effects of the drug, offering to present the side effects in a less visually dominant but still clear manner, and explaining the ethical imperative of truthful representation to the client. Option D. Create an illustration that visually exaggerates the benefits of the drug while subtly implying that side effects are minor and inconsequential to satisfy the client's request for a positive portrayal. The correct answer is C. Create an illustration that accurately depicts both the benefits and potential side effects of the drug, offering to present the side effects in a less visually dominant but still clear manner, and explaining the ethical imperative of truthful representation to the client. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's desire for a specific visual outcome and the medical illustrator's ethical obligation to accurately and responsibly represent complex medical information. The client's request to downplay the severity of a condition, even if for marketing purposes, directly clashes with the core ethical principle of truthfulness and accuracy in medical communication, which is paramount for the board-certified medical illustrator, CMI. Careful judgment is required to navigate this situation without compromising professional integrity or potentially misleading the audience. The correct approach represents best professional practice because it prioritizes ethical obligations over client demands when those demands compromise accuracy and responsible representation. A CMI is bound by the ethical guidelines of their profession, which emphasize honesty, integrity, and the avoidance of misrepresentation. By offering to create an accurate illustration that also addresses the client's need for a clear, understandable visual, while firmly refusing to distort the medical reality, the illustrator upholds these principles. This approach involves open communication, proposing alternative solutions that align with ethical standards, and ultimately, being prepared to decline the project if ethical boundaries cannot be met. This aligns with the CMI's responsibility to serve the public interest by ensuring medical information is conveyed truthfully. An incorrect approach that involves creating an illustration that intentionally downplays the severity of a medical condition, even if at the client's request, represents a significant ethical failure. This directly violates the CMI's duty of accuracy and truthfulness. Such an action could lead to misinformed patients, healthcare providers, or the public, potentially impacting treatment decisions or understanding of disease progression. This constitutes a breach of professional integrity and could have legal and reputational consequences. Another incorrect approach, which is to immediately refuse the project without attempting to find a compromise or educate the client on ethical considerations, while perhaps stemming from a desire to avoid ethical compromise, might be professionally suboptimal. While refusing unethical requests is necessary, a more nuanced approach involves attempting to guide the client towards an ethically sound solution. This missed opportunity to educate the client and explore alternative ethical visual strategies can be seen as a failure in professional stewardship. A professional decision-making process for similar situations should involve 1. Clearly identifying the ethical conflict. 2. Reviewing relevant professional ethical codes and guidelines, in this case CMI standards. 3. Communicating openly and honestly with the client about ethical boundaries and the importance of accurate representation. 4. Proposing alternative, ethically compliant solutions that still meet the client's underlying needs. 5. Being prepared to disengage from the project if ethical compromises are unavoidable and the client remains unwilling to adjust their request. Question 13. Compliance review shows that a medical illustrator has been asked by a client to provide a vector graphic of a complex anatomical illustration in a JPG format for future editing and scaling. The illustrator has proceeded with this request without further consultation. Which of the following approaches best aligns with professional standards and ethical obligations for medical illustrators? Option A. Export the vector graphic as a less common, proprietary vector format that the illustrator is most familiar with, assuming the client will be able to find software to open it. Option B. Export the vector graphic as a high-resolution PNG file, as this format is widely supported and can be scaled to a reasonable extent without significant quality loss. Option C. Export the vector graphic as a JPG file as requested by the client, as the client is paying for the service and their request should be honored without question. Option D. Export the vector graphic as an SVG, scalable vector graphics file, explaining to the client that this format preserves scalability and editability, and also provide a high-resolution PNG for general use, discussing the limitations of JPG for scaling. The correct answer is D. Export the vector graphic as an SVG, scalable vector graphics file, explaining to the client that this format preserves scalability and editability, and also provide a high-resolution PNG for general use, discussing the limitations of JPG for scaling. Explanation. Scenario analysis. This scenario presents a common challenge in medical illustration where the client's request for a specific file format for a vector graphic may not align with best practices for ensuring long-term accessibility and editability of the artwork. The medical illustrator must balance client needs with professional standards and ethical considerations regarding intellectual property and archival quality. The challenge lies in understanding the implications of different vector formats beyond superficial client preference, particularly concerning compatibility, data integrity, and future modification rights. Correct approach analysis. The correct approach prioritizes the use of a widely supported and robust vector format like SVG, Scalable Vector Graphics, or AI, Adobe Illustrator's native format, when the client has indicated a need for editability and scalability. SVG is an open standard, ensuring broad compatibility and future accessibility, which aligns with ethical considerations of providing artwork that can be readily used and modified by the client or their designated parties without proprietary software lock-in. AI, while proprietary, is the industry standard for professional vector illustration and preserves the full editability of the artwork within its native software environment. The illustrator's responsibility is to provide a format that best serves the client's stated needs for future use, while maintaining the integrity and editability of the original work, adhering to professional standards of delivering high-quality, usable assets. Incorrect approaches analysis. Choosing a raster format like JPG or PNG for a graphic that is intended to be scalable and editable is a significant regulatory and ethical failure. Raster formats are pixel-based and lose quality when scaled up, directly contradicting the inherent advantage of vector graphics. This failure violates the professional obligation to deliver artwork that meets the client's functional requirements and can lead to unusable assets, potentially breaching contractual agreements and damaging professional reputation. Furthermore, it demonstrates a lack of understanding of fundamental digital art principles, which is a failure in professional competence. Exporting to a less common or proprietary vector format without clear justification or client understanding is also problematic. While it might technically be a vector file, if it requires obscure software for editing or has limited compatibility, it hinders the client's ability to utilize the artwork effectively. This can be seen as an ethical lapse if it creates an undue dependency on specific software or the Illustrator, potentially impacting the client's future flexibility and control over their assets. It also fails to uphold the principle of delivering the most practical and accessible solution, failing to discuss file format implications with the client, and simply defaulting to a format requested without understanding the underlying need is a failure in professional communication and client service. This can lead to misunderstandings and dissatisfaction, as the client may not realize the limitations of their chosen format until later. It bypasses the crucial step of informed consent and collaborative decision-making, which is essential for ethical client relationships. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the client's explicit and implicit needs. This involves active listening and asking clarifying questions about the intended use of the artwork, future modification requirements, and the client's technical capabilities. The illustrator should then assess which file formats best meet these needs, considering factors like scalability, editability, compatibility, and archival quality. They must then clearly communicate the advantages and disadvantages of recommended formats to the client, ensuring informed consent before proceeding. This process upholds professional integrity by prioritizing client satisfaction, delivering high-quality and functional assets, and adhering to ethical standards of transparency and competence. Question 14. Cost-benefit analysis shows that developing a novel, highly detailed 3D rendering of the trigeminal nerve pathway, including its intricate branching and sensory innervation of the face, would be significantly more time-consuming and expensive than utilizing existing, albeit less specific, anatomical diagrams. The client, a pharmaceutical company, is developing a new analgesic targeting neuropathic facial pain. They require an illustration for a patient education brochure that clearly explains how the drug interacts with specific nerve receptors. Considering the CMI certification standards and ethical obligations, what is the most appropriate course of action? Option A. Proceed with a simplified, stylized illustration of the trigeminal nerve that emphasizes the concept of pain transmission rather than precise anatomical accuracy, as the primary goal is to convey the drug's effect on pain perception. Option B. Source a generic stock image of a human head with superficial nerves visible and label it to indicate the general area of facial pain, without specific anatomical detail of the trigeminal nerve itself. Option C. Create a completely new, highly detailed 3D rendering of the trigeminal nerve pathway, prioritizing visual complexity and novelty to ensure the illustration is unique and impressive, even if it requires exceeding the initial budget and timeline. Option D. Collaborate with the client to adapt a high-quality, scientifically validated existing illustration of the trigeminal nerve, focusing on the relevant branches and receptor sites, and supplement it with clear annotations and descriptive text to explain the drug's mechanism of action. The correct answer is D. Collaborate with the client to adapt a high-quality, scientifically validated existing illustration of the trigeminal nerve, focusing on the relevant branches and receptor sites, and supplement it with clear annotations and descriptive text to explain the drug's mechanism of action. Explanation. This scenario presents a professional challenge due to the inherent complexity and sensitivity of depicting neurological structures and their functions. The demand for accuracy in illustrating the nervous system, particularly for educational or clinical purposes, requires a deep understanding of anatomy, physiology, and potential pathologies. The challenge lies in balancing the need for scientific fidelity with the communicative effectiveness of the illustration, ensuring it serves its intended audience without misrepresenting critical information. Careful judgment is required to select the most appropriate visual strategies that convey complex neural pathways and processes clearly and accurately, adhering to established scientific and ethical standards. The correct approach represents best professional practice because it prioritizes accuracy, clarity, and adherence to established scientific and ethical guidelines for medical illustration. By consulting with neurologists and neurosurgeons, the medical illustrator ensures the depiction aligns with current medical understanding and clinical practice. This collaborative process validates the anatomical and functional representations, minimizing the risk of misinterpretation by the intended audience. Furthermore, seeking peer review from other certified medical illustrators provides an additional layer of quality control, ensuring the illustration meets the high standards expected of a board-certified medical illustrator, CMI, in terms of both scientific accuracy and visual communication. This meticulous approach upholds the integrity of the medical information being conveyed and the professional reputation of the illustrator. An incorrect approach that relies solely on readily available stock imagery without verification fails to meet professional standards. Stock imagery, while convenient, may not be anatomically precise, up-to-date, or tailored to the specific clinical context required. This can lead to the dissemination of inaccurate information, which is a significant ethical failure in medical illustration. Another incorrect approach, focusing solely on aesthetic appeal over scientific accuracy, is also professionally unacceptable. While visual appeal is important for engagement, it must never compromise the factual correctness of the illustration. Misleading visual representations of neurological structures or functions can have serious consequences for patient understanding, medical education, and clinical decision-making. Such an approach demonstrates a disregard for the core responsibility of a medical illustrator: to communicate complex scientific information accurately. The professional decision-making process for similar situations should involve a systematic evaluation of the project's requirements, the target audience, and the available resources. It necessitates a commitment to scientific accuracy, ethical practice, and continuous learning. When dealing with complex anatomical systems like the nervous system, consultation with subject matter experts is paramount. Peer review and adherence to professional guidelines, such as those established by the Association of Medical Illustrators (AMI) and the certifying body for CMIs, are crucial for ensuring the quality and integrity of the work. The process should always prioritize the accurate and clear communication of scientific information, recognizing the potential impact of the illustration on its viewers. Question 15. Consider a scenario where a medical illustrator is tasked with creating a series of raster graphics for a patient education brochure explaining a complex surgical procedure. The source material includes high-resolution medical scans. The illustrator identifies areas within the scans that, if slightly blurred or softened using raster editing tools, would make the overall image appear less intimidating to patients. What is the most ethically and professionally sound approach to handling this raster graphics task? Option A. Enhance the contrast and sharpness of the raster graphics to make the surgical site appear cleaner and more precise, thereby projecting confidence in the procedure's success. Option B. Apply subtle raster editing techniques to soften or blur visually alarming aspects of the medical scans to reduce patient anxiety, while ensuring the core anatomical structures remain identifiable. Option C. Use raster graphics from publicly available online sources that depict similar procedures, as these are often more aesthetically pleasing and less graphic. Option D. Refrain from any raster manipulation that alters the visual fidelity of the original medical scans, focusing instead on clear labeling and accompanying text to explain the procedure and address patient concerns. The correct answer is B. Apply subtle raster editing techniques to soften or blur visually alarming aspects of the medical scans to reduce patient anxiety, while ensuring the core anatomical structures remain identifiable. Explanation. This scenario presents a professional challenge because medical illustrators, even when working with raster graphics, are bound by ethical and legal standards regarding the integrity and appropriate use of visual information. The core issue revolves around maintaining the accuracy and ethical representation of anatomical and pathological details, which directly impacts patient care, medical education, and research. The CMI certification implies a commitment to upholding these standards. The correct approach represents best professional practice because it prioritizes the accurate and ethical representation of medical information. By ensuring that raster graphics are not manipulated in a way that distorts or misrepresents anatomical structures or pathological findings, the illustrator upholds the scientific integrity of their work. This aligns with the CMI's responsibility to provide clear, accurate, and unbiased visual communication, preventing potential misinterpretations by healthcare professionals, students, or the public. Adherence to copyright and licensing agreements for any source raster graphics is also a fundamental ethical and legal requirement. An incorrect approach that involves altering raster graphics to exaggerate or minimize pathological features for aesthetic purposes is ethically unacceptable. This directly violates the principle of accurate representation, potentially leading to misdiagnosis, flawed treatment planning, or misleading educational materials. Such manipulation undermines the trust placed in medical illustrators and can have serious consequences for patient outcomes. Another incorrect approach, using raster graphics without verifying their licensing or copyright, constitutes intellectual property infringement, which carries legal ramifications and is a breach of professional ethics. Furthermore, failing to maintain the original resolution and detail of raster graphics when they are intended for high-fidelity reproduction, e.g., for surgical planning or detailed anatomical study, can render the illustration ineffective and misleading, thus failing to meet professional standards. The professional decision-making process in such situations requires a thorough understanding of the intended use of the illustration, the ethical obligations of medical illustrators, and relevant legal frameworks concerning intellectual property and data integrity. Illustrators must critically evaluate the source material, understand the impact of any proposed modifications, and always prioritize accuracy and ethical representation over purely aesthetic considerations or convenience. Consulting with the requesting medical professional to clarify the exact requirements and intended audience is crucial. Question 16. The investigation demonstrates that a board-certified medical illustrator, CMI, is developing an anatomical illustration for a patient education brochure explaining a common surgical procedure. The CMI is considering how to best present the complex anatomical relationships and procedural steps to a lay audience. Which of the following approaches to visual design best aligns with the professional responsibilities of a CMI in this context? Option A. Creating a dense, highly detailed illustration with minimal contrast and a uniform pattern throughout, assuming that a comprehensive visual representation will inherently lead to better patient understanding. Option B. Prioritizing a highly stylized and abstract artistic interpretation of the anatomy to create a visually striking and memorable image, even if it means deviating from strict anatomical accuracy to enhance aesthetic appeal. Option C. Focusing solely on the technical accuracy of each individual anatomical structure, disregarding the overall compositional balance and the flow of visual information, resulting in a series of disconnected elements. Option D. Employing a balanced composition with strategic contrast to highlight critical anatomical landmarks and procedural actions, using subtle movement and rhythm to guide the viewer's eye through the sequence of events, without overwhelming them with excessive detail or jarring visual elements. The correct answer is D. Employing a balanced composition with strategic contrast to highlight critical anatomical landmarks and procedural actions, using subtle movement and rhythm to guide the viewer's eye through the sequence of events, without overwhelming them with excessive detail or jarring visual elements. Explanation. This scenario presents a professional challenge for a board-certified medical illustrator, CMI, tasked with creating an anatomical illustration for a patient education brochure. The challenge lies in balancing the need for clear, accurate anatomical representation with the principles of visual design to ensure effective communication and patient comprehension. The CMI must consider how elements like balance, contrast, emphasis, movement, pattern, and rhythm contribute to the overall impact and understanding of the illustration, while adhering to professional standards of clarity and ethical representation. The correct approach represents best professional practice because it prioritizes the primary goal of patient education through clear, accessible visual communication. By strategically employing balance to create a stable and organized composition, contrast to highlight key anatomical structures, emphasis to draw attention to critical areas, and subtle movement, pattern, and rhythm to guide the viewer's eye naturally through the illustration. CMI ensures that the information is not only accurate, but also easily digestible and memorable for a lay audience. This aligns with the ethical imperative of providing clear and understandable medical information to patients, fostering informed decision-making and engagement with their health. An incorrect approach that fails to consider the principles of visual design would be to create an illustration that is technically accurate but visually cluttered or confusing. This could involve poor balance, leading to a composition that feels unstable or overwhelming, or a lack of contrast, making it difficult to distinguish important structures from less critical ones. Overuse of emphasis or jarring patterns could create visual noise, hindering comprehension rather than aiding it. Such an approach would be ethically problematic, as it fails to meet the standard of clear communication expected of a CMI, potentially leading to patient misunderstanding or disengagement with their healthcare information. Another incorrect approach might be to prioritize aesthetic appeal over anatomical clarity, resulting in an illustration that is visually striking but sacrifices accuracy for artistic license. This would be a failure of professional responsibility, as the primary function of a medical illustration in this context is accurate information delivery, not purely artistic expression. The professional decision-making process for similar situations should involve a systematic evaluation of the illustration's purpose and target audience. The CMI should first establish the core anatomical information to be conveyed, and then consider how visual design principles can best serve that purpose. This involves iterative sketching and refinement, seeking feedback from peers or subject matter experts, and critically assessing the illustration's effectiveness in communicating complex information clearly and engagingly. The ultimate goal is to create an illustration that is both scientifically sound and visually effective, fulfilling the CMI's role as a vital link in the healthcare communication chain. Question 17. Upon reviewing a patient's CT scan for the purpose of creating a detailed 3D anatomical model for an educational presentation, what is the most ethically sound and professionally responsible course of action regarding the use of the patient's imaging data? Option A. Proceed with creating the 3D model using the patient's imaging data, as the data will be anonymized and used solely for educational purposes. Option B. Utilize publicly available generic anatomical 3D models that are similar to the patient's condition to avoid any potential privacy concerns. Option C. Create the 3D model based on the patient's imaging data and share the raw, unanonymized imaging data with the 3D modeling software provider for their review and potential use. Option D. Obtain explicit, informed consent from the patient for the use of their anonymized imaging data in the 3D model creation and presentation. Correct answer is D. Obtain explicit, informed consent from the patient for the use of their anonymized imaging data in the 3D model creation and presentation. Explanation. This scenario presents a professional challenge due to the inherent responsibility of medical illustrators to accurately and ethically represent complex anatomical and procedural information, especially when utilizing advanced 3D modeling techniques. The challenge lies in balancing the artistic and technical demands of 3D modeling with the stringent requirements for scientific accuracy and patient privacy, mandated by professional standards and potentially relevant regulations. Though specific regulations for medical illustrators are not explicitly defined in a single overarching framework like those for medical practitioners, the core ethical considerations revolve around informed consent for data usage, data security, and the accurate representation of medical information to avoid misinterpretation by the intended audience. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the patient for the use of their anonymized medical imaging data in the 3D model. This aligns with the ethical principles of patient autonomy and privacy, which are foundational in healthcare and, by extension, in medical illustration when patient-specific data is involved. By anonymizing the data, the illustrator further mitigates privacy risks, ensuring that the resulting 3D model, while derived from real patient data, does not contain identifiable information. This approach respects the patient's rights and adheres to the highest ethical standards of professional conduct in medical illustration, ensuring that the creation and use of 3D models are both scientifically sound and ethically defensible. An incorrect approach that involves proceeding with the 3D modeling using patient imaging data without any form of consent, even if anonymized, represents a significant ethical failure. This violates the principle of patient autonomy and the implicit trust placed in healthcare professionals and their collaborators. While anonymization is a crucial step, it does not negate the need for consent for the initial use of the data for a purpose beyond direct clinical care. Another incorrect approach, which is to use publicly available generic anatomical models for the 3D representation, fails to leverage the unique learning opportunity presented by the patient's specific condition. While this might avoid consent issues, it sacrifices the potential for a highly tailored and instructive educational tool that could be invaluable for understanding the patient's unique pathology or surgical plan. This approach prioritizes convenience over the potential for enhanced understanding and communication derived from patient-specific data. A third incorrect approach, which is to create a 3D model based on the patient's imaging data, but then share the raw, anonymized data with the modeling software provider, constitutes a severe breach of patient privacy and confidentiality. This exposes the patient to significant risks and is a direct violation of ethical obligations and potentially data protection regulations, even if the provider claims to have their own privacy policies. Professionals should employ a decision-making framework that begins with identifying the source of the data and its intended use. The next step involves assessing the privacy and ethical implications of using that data. If patient-specific data is involved, the paramount consideration is obtaining appropriate consent, ensuring data anonymization where possible, and understanding the terms of use for any software or platforms involved. Transparency with the patient and adherence to ethical guidelines for medical illustration should always guide the process, especially when dealing with sensitive medical information and advanced visualization techniques. Question 18. Benchmark analysis indicates that medical illustrators utilizing traditional pencil and ink techniques for anatomical renderings face challenges in balancing aesthetic appeal with scientific fidelity. Considering the ethical and professional obligations inherent in board-certified medical illustrator (CMI) standards, which approach to pencil and ink application best upholds these principles when depicting complex surgical procedures. Option A. Relying on heavy graphite smudging and soft, blended pencil lines to create a painterly effect, prioritizing a sense of atmosphere over precise anatomical definition. Option B. Utilizing broad, expressive brushstrokes with ink washes to create a dramatic and artistic interpretation of the surgical field, emphasizing movement and emotion. Option C. Incorporating stylized line work and exaggerated contours to convey a sense of dynamism and energy, even if it deviates slightly from strict anatomical proportions. Option D. Employing a variety of line weights and controlled hatching to clearly delineate anatomical planes, highlight critical structures, and indicate depth without obscuring underlying details. The correct answer is D. Employing a variety of line weights and controlled hatching to clearly delineate anatomical planes, highlight critical structures, and indicate depth without obscuring underlying details. Explanation. This scenario presents a professional challenge due to the inherent tension between artistic interpretation and scientific accuracy, particularly when using traditional pencil and ink techniques which can be subjective. The board-certified medical illustrator (CMI) certification implies adherence to rigorous standards of accuracy, clarity, and ethical representation of anatomical and physiological information. The challenge lies in ensuring that the chosen pencil and ink techniques, while aesthetically pleasing and effective for conveying depth or texture, do not compromise the precise depiction of medical subject matter. The correct approach represents best professional practice because it prioritizes the primary ethical and professional obligation of a medical illustrator: accurate and unambiguous representation of medical information. By selecting pencil and ink techniques that enhance clarity and precision, such as fine line work for anatomical detail and controlled shading to indicate form without obscuring structures, the illustrator upholds the CMI standards. This approach ensures that the artwork serves its intended purpose of educating, informing, or communicating medical concepts effectively and truthfully to the intended audience, be it clinicians, students, or patients. This aligns with the CMI's commitment to scientific integrity and professional responsibility. An incorrect approach that relies heavily on expressive or gestural line work, without careful consideration for anatomical accuracy, would fail to meet CMI standards. Such an approach risks introducing ambiguity or misrepresentation of critical medical details, potentially leading to misunderstanding or misinformation. This constitutes an ethical failure by not upholding the principle of truthfulness in scientific illustration. Another incorrect approach that uses excessive or uncontrolled ink washes or heavy graphite smudging could obscure fine anatomical structures or subtle pathological features, thereby compromising the clarity and diagnostic value of the illustration. This is a failure to adhere to the professional standard of clear and precise communication. A third incorrect approach that prioritizes a specific artistic style over the clarity of medical information. For example, by using stylized rendering that deviates from anatomical norms, would also be professionally unacceptable. This represents a deviation from the core mandate of medical illustration, which is to accurately depict medical reality. The professional reasoning process for similar situations should involve a constant self-assessment of whether the chosen artistic techniques serve the primary goal of accurate and clear medical communication. This requires a thorough understanding of the subject matter, the intended audience, and the specific requirements of the project. The illustrator must ask, does this technique enhance or detract from the clarity of the anatomical structures? Does it accurately convey the intended physiological process? Is there any potential for misinterpretation? Prioritizing scientific accuracy and clarity, even when employing traditional media like pencil and ink, is paramount. Question 19. Examination of the data shows a medical illustrator has been commissioned to create an illustration of a novel surgical technique for a prominent medical journal. The lead surgeon has provided a rough sketch and a brief description, but the illustrator identifies several anatomical details that are simplified in the sketch and could be misleading if depicted without further clarification. The illustrator also notes that the proposed color palette for the illustration, while aesthetically pleasing, does not accurately represent the typical tissue coloration during the described surgical phase. The illustrator's primary goal is to produce an illustration that is both scientifically accurate and suitable for publication in a peer-reviewed journal. Which of the following approaches best upholds the principles of medical illustration and ethical practice within the U.S. regulatory framework? Option A. Proceed with the illustration based on the surgeon's sketch and personal artistic judgment, prioritizing a visually appealing and easily understandable representation for a broad audience. Option B. Consult with the lead surgeon to clarify the anatomical details and discuss the color palette, referencing peer-reviewed literature and anatomical atlases to ensure accuracy before proceeding with the illustration. Option C. Make significant artistic modifications to the anatomical structures to enhance clarity and visual impact, assuming the surgeon will approve any changes that improve the overall aesthetic. Option D. Create the illustration using the proposed color palette and simplified anatomical forms, as the journal's editorial guidelines often allow for some artistic license in scientific illustrations. The correct answer is B. Consult with the lead surgeon to clarify the anatomical details and discuss the color palette, referencing peer-reviewed literature and anatomical atlases to ensure accuracy before proceeding with the illustration. Explanation. This scenario presents a common challenge in medical illustration, where the artist must balance the need for scientific accuracy with the practical constraints of a publication or presentation. The core of the challenge lies in ensuring that any simplification or artistic interpretation does not mislead the intended audience, which in this case includes medical professionals and potentially patients. Adherence to the board's Certified Medical Illustrator (CMI) Code of Ethics and relevant U.S. regulatory frameworks, such as those governing medical device marketing or patient education materials, is paramount. The correct approach prioritizes scientific integrity and ethical communication. By consulting with the lead surgeon and referencing peer-reviewed literature, the illustrator ensures that the visual representation accurately reflects the surgical procedure's key anatomical structures and steps, even if some minor details are omitted for clarity. This aligns with the CMI's ethical obligation to produce accurate and truthful representations. Furthermore, it respects the intellectual property and expertise of the medical professionals involved. An incorrect approach would involve making significant artistic liberties without consultation, potentially leading to misrepresentation. For instance, altering anatomical proportions or omitting critical steps could violate the CMI's duty of accuracy and could have downstream ethical implications if the illustration is used in patient education or marketing, potentially falling under FDA guidelines for truthful and non-misleading information. Another incorrect approach might be to rely solely on a single, potentially outdated, source without verifying current best practices or surgeon-specific techniques, which fails to meet the standard of due diligence expected of a certified professional. A third incorrect approach could be to prioritize aesthetic appeal over accuracy, which directly contravenes the fundamental principles of medical illustration and the CMI's ethical mandate. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the purpose and audience of the illustration. Second, gather all relevant scientific and clinical information. Third, engage in open communication with subject matter experts. Fourth, critically evaluate the balance between accuracy and clarity, making only those simplifications that do not compromise the integrity of the information. And finally, document all decisions and consultations. Question 20. Performance analysis shows that a medical illustrator is tasked with creating a series of infographics for a public health campaign about a new vaccination. The target audience has varying levels of health literacy. Which approach best ensures effective and ethical visual communication? Option A. Utilizing highly stylized and abstract imagery to make the infographics visually striking and memorable, even if it means sacrificing some precise anatomical detail. Option B. Incorporating trending visual aesthetics and popular cultural references to maximize engagement, without extensive review for scientific accuracy or potential misinterpretation. Option C. Focusing on creating visually complex illustrations that showcase the intricate workings of the immune system, assuming a highly educated audience will appreciate the depth. Option D. Employing a consistent visual style that emphasizes anatomical accuracy and uses clear, universally understood symbols and color palettes, while ensuring all information presented is scientifically validated and avoids sensationalism. The correct answer is D. Employing a consistent visual style that emphasizes anatomical accuracy and uses clear, universally understood symbols and color palettes, while ensuring all information presented is scientifically validated and avoids sensationalism. Explanation. Scenario analysis. This scenario presents a professional challenge because the medical illustrator must balance the need for clear, accurate visual communication with the ethical imperative to avoid misrepresentation, especially when dealing with sensitive patient information or complex medical concepts. The potential for misinterpretation or oversimplification carries significant risks, impacting patient understanding, physician decision-making, and the overall integrity of medical information. Careful judgment is required to ensure the visual aids are both informative and ethically sound. Correct approach analysis. The correct approach prioritizes clarity, accuracy, and ethical representation. This aligns with the core principles of medical illustration, which demand that visuals serve to educate and inform without misleading. By focusing on established visual communication principles such as appropriate use of color, scale, perspective, and anatomical accuracy, the illustrator ensures the visual aids are easily understood and scientifically sound. This approach upholds the professional standards of the board-certified medical illustrator, CMI, by ensuring that the visual communication is effective, truthful, and serves the best interests of the audience and the medical field. Incorrect approaches analysis. One incorrect approach might involve prioritizing aesthetic appeal over scientific accuracy. This fails to meet the fundamental requirement of medical illustration to be factually correct. Such an approach could lead to misinterpretations of anatomical structures, disease processes, or treatment mechanisms, potentially causing harm or confusion. This violates the ethical obligation to provide truthful and accurate representations. Another incorrect approach could be the oversimplification of complex medical information to the point of losing critical detail or nuance. While simplification is often necessary for effective communication, excessive simplification can create a false understanding of a condition or procedure. This risks misinforming the audience and undermining the educational purpose of the visual aid, which is a failure in professional responsibility. A third incorrect approach might involve the use of ambiguous or culturally insensitive imagery. Medical illustrations are intended for a diverse audience, and the use of symbols or representations that are not universally understood or that could be perceived as offensive is a significant ethical and professional failing. This demonstrates a lack of consideration for the audience and a disregard for the principles of inclusive and effective communication. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the target audience and the specific communication objective. This involves identifying potential areas of misinterpretation and proactively addressing them through established visual communication principles. A critical review process, involving subject matter experts and potentially members of the target audience, is essential to validate accuracy and clarity. Adherence to ethical guidelines, including those pertaining to truthfulness, accuracy, and avoiding bias, should be paramount throughout the creation process.